Hi, everyone. Welcome to this event, Future Proofing Healthcare, How Mentoring is Combating Workforce Challenges. And we really appreciate you spending this hour with us. I'm going to go ahead and start things off with some introductions, and I'll go ahead and start. I'm Taylor Carrier, and I'm an enterprise customer experience manager here at Chronus. And during my time at Chronus, I've had the pleasure of partnering with organizations across many different industries, really helping them to best leverage the Chronus solution for their mentoring or employee community programs. And next, I'd like to introduce our panelists today for our webinar. I'll start with Jess Logan. Jess serves as a career development consultant at Houston Methodist, focusing on strategic design, development, and deployment of career development initiatives across the Houston Methodist system. Jess began her professional career as a research scientist and faculty member with a specialty in cognitive neuroscience, and she completed her PhD and postdoc in cognitive psychology and neuroscience. In 2018, she joined Houston Methodist, first in organizational development and now in career development as a professional certified coach. Jess is passionate about using mentoring and strength psychology to help individuals build awareness on their own styles and gifts and leverage the experience and insights of those around them to achieve their professional development goals. We also have Lola Tumaini, and Lola is a senior membership marketing specialist at the American Nurses Association, where she leads efforts to enhance member retention through strategic marketing initiatives. With over 6 years of experience at ANA, she oversees the organization's mentoring hub programs, which includes the career mentoring and flash mentorship programs. These programs help nurses connect, grow, and advance in their careers. And her work focuses on strengthening the ANA membership value proposition, including initiatives to prevent nurse burnout and support professional development. Passionate about mentorship, Lola plays a key role in creating meaningful connections that empower nurses at all stages of their careers. And we also have Janelle Wozniak with us. Janelle is a nursing professional development practitioner responsible for leadership development and mentorship within the Department of Nursing at Mayo Clinic and also supports the enterprise staffing pool. Her previous roles include serving as a clinical resource nurse for the burn ICU in Abu Dhabi as part of Mayo Clinic's joint venture, an MPD practitioner supporting inpatient staff within medical cardiology, a staff nurse in progressive and intensive care, a charge nurse, a rapid response team nurse, a preceptor, and she has served on multiple committees. Janelle also has a passion for academia and served as an adjunct faculty for Winona State University, both in the clinical setting and high fidelity simulation. So thank you all for being here today. Let's take a quick look at our agenda for our webinar. And we're going to be talking about a few different areas here, starting with some challenges within the healthcare sector, moving into mentoring programs and how these programs can be structured to support those challenges within the healthcare space. We'll get into some best practices and tips for these types of programs, and then we will conclude with a Q&A. So, if you have any questions, we can address those as well. And before we get started with our panel, I did just want to share a little bit with you all about Chronus for those of you that may be joining us for the very first time today. Chronus is a purpose-driven development platform that offers mentoring and connection community software to help enterprise organizations combat the disengagement and organizational connection crisis. And we've helped large organizations like enterprises, government agencies, nonprofits, and academic institutions do this for over 15 years. And our platform really makes customers feel secure, supported, and ready to scale their programs. So if you'd like to learn a little bit more about how we can help your organization to build a purposeful development strategy, there is a Talk to Our Experts button. It's going to be in the right corner of your screen. You can click on that at any time to get connected and learn more. All right, a few quick housekeeping tips before we move on. If you do have any questions for us during today's presentation, we would love to hear from you. So feel free to pop those into the Q&A section of the chat box. That'll be right there on your main screen. If you have any thoughts or comments or just want to connect with other participants today, that's what that chat section is for. And then we also have a messages box. So if you need any help with audio video issues or have a specific question, you can ask that there. And then there's also a docs section. So this is where you can find different resources associated with our webinar today. We actually have a pretty cool case study about one of our healthcare customers. So if you want to check that out, that's where you'll find it. And if you're not quite sure where to put something, totally fine. Drop it wherever feels right to you, and we'll make sure that it gets to the right place. All right, so great to see where everyone is from today. They're in the chat. Before we dive into our discussion, we did just want to learn a little bit more about you. So we're going to have a couple of quick polls. The first is going to pop up in just a moment here. So what industry is your organization in? Right, we got some education, healthcare, finance, professional services. Awesome. So a little bit of a spectrum. I think regardless of your industry, I know we're focusing on healthcare, but I think there's a ton to learn. So that's great. Cool. All right. Well, I think we're ready to go ahead and get started. So we'll start with our first question here. And the first kind of area that we wanted to dig into is just some of the specific workforce challenges that you're facing in healthcare. So I would love to know what are some of the biggest challenges facing your organizations, perhaps even specifically within the area that you oversee. And Lola, I would love for you to kick us off today.
Yeah, sure. So, are you guys getting feedback? Okay.
You're
good. Okay. So I would say probably one of the biggest challenges we face in the area I oversee would be our member retention. We have nurses that come from a wide range of specialties. However, we take a more generalist approach to the benefits we offer rather than focusing heavily on maybe specialty specific needs of our nurses. And while we have other departments that may create and offer specialty focused resources, our role in membership is to ensure that we're supporting all nurses with the challenges they face across the profession. And so some nurses may require that specialization, but we just want to make sure that they recognize the value we have beyond that specialty, and see us as our membership as a vessel that they can have through each stage of their career.
And I know, Janelle, you kind of service some, the same audience, right, with that nursing population. Are you, seeing similar challenges, or what has that experience been for you?
Yes, I'm definitely seeing similar challenges. I would say retention is key, but finding the core of what is causing that change in retention, the core issue behind it. I think regardless if you're in healthcare, education, any work environment at this point post-COVID, everybody is experiencing a little bit of an interesting shift as far as individuals are just reassessing and reevaluating what's important to them and where they want to work and how they want to work. So I think regardless of the organization that you're in and the kind of type of work that you're in, we're all impacted by retention concerns right now. Me in particular, we've noticed a significant, just a change in engagement. So those that are sticking around aren't as engaged as they historically had been. So really trying to keep our staff, but also to engage them in a way that fills their cup.
Mm-hmm. Yeah. And I mean, Jess, does that resonate with you as well? I can kind of see you shaking your head.
Yeah, definitely. We've certainly seen some changes over the last couple of years. At Houston Methodist, our mentoring program serves the entire employee population, so clinical roles, non-clinical roles. But that retention is a really big piece for us, especially for new people coming in, and also internal mobility. So we invest a lot when we make our hiring decisions for every role, and when we get great talent, we want to keep them. And a lot of people want to be able to grow within the organization, but aren't necessarily sure how. So that's a big goal for us as well, that if people are interested in moving to a different role, different specialty, or even just wanting to jump to a different career, make a career change, that they feel prepared to do that and they know how to do that. And then long term, I'd say some of our other challenges are really thinking about, which is again related to internal mobility and retention, building those talent pipelines and those talent pools so that we can, better plan for, our workforce for the future, and have an engaged employee population that understands where they can move and how they can move and still feel engaged and contribute to the organization.
Yeah. Yeah, no, thank you all for sharing. And I'm glad you brought up too just the mobility piece too, because I know that plays so much into retention. Like if as an employee, I can kind of see what avenues and options are available to me, right? Then I'm going to be, able to stay within that organization. So I think that certainly, intersects with retention. So given all of these challenges that you all have described, how has mentoring helped to address them? Janelle, would you like to kick us off there?
Yeah, absolutely. We know, really, I guess the goals of our mentoring program is to really foster a culture of support and belonging and engage our staff and support them on their journey for professional development. As Jess had shared, it's really important to invest in our staff and have an understanding of how we can best support them. While I would love to keep every single nurse in my little corner of the world, and hog those great employees and not share them with the rest of the organization, really the intention that we all should have is that every employee, every individual within our team, we want to develop them and support them to be the best version of themselves, the happiest version of themselves. And many times that might be a career change. That might be seeking out a completely different opportunity than what they're currently in. And I think mentoring is the jackpot ticket to support our teams in helping them navigate that path of just life and growth and change. So really just leaning in to mentors and mentorship opportunities and ensuring that our teams are able to access that.
Yeah, I completely agree
Lola,
with
Jess, would you have anything else to add there?
Yeah, I completely agree with what Janelle is saying, especially that feeling of fostering belonging, feeling connected to the organization. I have a place here, I have a future here, that can really make a huge difference to people's engagement and their desire to stay, as well. And when, like for our particular organization, we're a fairly large organization, 33,000 employees. We have 8 different hospitals across the greater Houston area, which is a big sprawling place. And mentoring has actually allowed us to form connections across the system, which has traditionally been difficult for us to do. And the fact that, most of our mentoring connections happen virtually allows people to contact each other or connect with each other at, hospitals clear across Houston, which could be easily an hour and a half drive, otherwise it's, get to meet people they wouldn't otherwise meet. So I think that that's a big part of it. Also, having a mentor within our organization allows people to see what it takes to be successful at Houston Methodist. There's only so much information you could get from a job description or a Google search or watching YouTube videos in terms of what is this career like. So being able to directly connect with someone who's built their career at Houston Methodist is really, really valuable for helping them put their best foot forward as an internal applicant.
And I'll add, so our program is not like an employee-based program, but we're connecting nurses from across the nation with one another. And in instances where our members maybe want privacy with the situation they're going through, we can provide that. We're not matching them internally with other people in their organization. They can be matched with someone across the nation. And with that, they can see that any problems they're going through are not unique to them or their location, that it's something that the nurses are facing across the nation. And so we see that as a way for the nurses to feel more connected to the career as a whole. They have a wider network of access to the nursing community as a whole. And we think then that helps them build confidence and provides career clarity overall.
Yeah, no, thank you all for sharing. And I'd like to move into more of the program like design and structure and kind of how these programs are then being built to combat some of these challenges. So what I'd like to do next is just have everyone walk through your different program or programs, and just kind of how it's structured, what formats you're using, maybe what matching styles you're using, and just kind of how that all functions. And Jess, I'd love to start with your program.
Yes, absolutely. So our program is called Mentor Match, and it is open system-wide to all employees across Houston Methodist, all of our different hospitals and areas. And the format we use the most is one-on-one mentoring, so allowing people to connect with mentors one-on-one. But we also encourage our mentees to use it for information interviewing. A lot of our mentees are looking for their next role and kind of how they want to grow, and are kind of trying to decide between different areas. So information interviewing is a great way to do that as well. And we allow people to self-match, so they get suggested matches, which is one of the best parts of Chronus. And they get to look through different profiles, reach out to mentors and meet with them, and then form a connection with them. And by default, it lasts for 6 months, but people can extend it as well. But it's, allows them to kind of go in and explore and think about who they might want to connect with there.
Awesome. Thank you. Janelle, do you want to share a little bit about your programming?
Yeah, happy to. So mine is similar to Jess's concepts. The major difference probably is that we have multiple tracks. So much like Jess, my organization that I work for is large. We span the nation and actually the globe. So we have hospitals and health systems primarily across the Midwest, but also in Florida, Arizona, and London. Most recently, we did also have a site in Abu Dhabi for a couple of years. So it's definitely spanning the miles. So our hope is really to reach people across those various sites that, exactly like Jess said, that you wouldn't typically cross paths with, that could be a perfect fit for you, and you never knew you even worked for the same organization. So we have broken it down into 4 programs. So we have 4 options for all employees within the Department of Nursing. And I know that every Department of Nursing varies a little bit. Ours has a variety of staff within it. We have administrative assistants, we have unlicensed personnel, we have surgical techs, LPNs, RNs, obviously managers, specialists, executive leaders, kind of the whole gamut. But we do have a lot of roles, entry-level roles, like technical staff and coordinators and different things, so that maybe their goal isn't to necessarily move up in the ranks within nursing, but it's to move on and do something different in another realm. So that's kind of a big future goal of ours. But so we have 4 tracks currently for the Department of Nursing. Across our organization, our Department of Nursing is massive. It's close to oh gosh, close to 38,000 now, I think, just for the Department of Nursing. Our organization is over 80,000. So it's a lot of people. It's self-matching at this point. We do have an algorithm behind the scenes to help kind of narrow down and provide top matches, but they have the liberty to peruse all of the wonderful mentors that are out there for them.
Thanks, Janelle. And do you see, just within all of the different programs that you have, are people a part of multiple programs, or are people, kind of participating in one at a time? Like what does that kind of participation look like?
Taylor, good segue. I think this is the point where I can give you a little plug that the perk of this platform is that individuals can participate in multiple tracks at the same time. So with our 4 tracks, I could support a brand new nurse in the residency track, and then also be developing myself, having a mentor maybe in a leadership track. So there's ways to kind of toggle between the various realms to ensure that we're meeting the needs of all employees across their career trajectory. I would say it's not the norm, Taylor, quite yet. I think because we're so new into the utilization of Chronus that people are just getting their feet wet and sticking with 1, maybe 2 options at this time. But I look forward to the day when people are just plucking every option available.
Absolutely. Yeah. Well, thank you. Lola, let's talk a little bit about your program.
Okay, yes. So we have, through the platform, we have 2 tracks. We have the career mentoring program, and that was the first program that we ever started. And that's a more structured long-term program where we administratively match nurses one-to-one. So we lead with years of nursing experience. So we take a more experienced nurse mentor, and they must be a licensed RN to be able to participate. And then we match them with the less experienced RN. And in the past, it lasted for 8 months. And more recently, we've shortened it to 6 months, because once people feel like their needs are met, then they check out. And the second one we have is Flash Mentoring. And that was birthed out of our RNs feeling like they need mentoring at any point in time, not just 6 months out of the year. Like when a new member joins, they may need a mentor right away, or they may be an experienced mentor and they want to provide their guidance right away. So Flash Mentoring just offers that like short-term, like one-time mentoring sessions where our nurses can connect as much as they want. More recently, we've been like trying to tie in both programs together. So while one is going through career mentoring, we'll say, hey, now that you and your mentor have found an area of focus, or there's this goal you have set out for you, why don't you make your way over to Flash Mentoring and try and find a Flash mentor that can help you give that more specialized focus on this particular goal. So we want them to use the programs hand in hand, and that's how it works. Yeah.
Thanks. Yeah, I love incorporating that Flash mentorship and just giving people like the option to have like, a quick coffee chat or a Zoom chat. I think sometimes it can be a little intimidating to just reach out to someone that you don't know, but if they're in the program, that they want to be a mentor, right? They want to help you. So I love having that added component. Getting a little bit more into, and I think we've kind of addressed, kind of the different audiences for your programs, but getting more into like, what does success look like for your programs? What are like 1 or 2 goals that you've really set out for in building these programs? And Janelle, I'd like to start with you.
Yeah. So really, the goals was for us to efficiently be able to have a platform that was easy for employees to access, that they could get a mentor match at any point in their career, at any point in time. That's our big picture, long-term goal. We knew that mentoring is occurring across our organization, in pockets across the organization, lots of silo endeavors. But that's a lot of work. It's a lot of work on each individual kind of site and educator to make that happen. And also, you're limiting your pool. It's like staying in your little tiny neighborhood and never expanding your horizons. And we all know that once you expand your network, you can just grow drastically. So striving to really ensure that we have it easily accessible for all employees, even for those people that are like, I don't know who to tap on, but I know that I want someone. So striving to have that, and really just, again, fostering that sense of belonging and connection and community. And really, how are we going to measure all of that? Well, we have wonderful pre and post surveys built within the Chronus platform. Also enrollment, and I see Jess has surpassed me with enrollment, and her organization is much smaller. So I need to up my ante. So I'm going to talk to Jess and make sure that I can get my numbers up, because by the time we do this again, I should be over Jess. It's just a personal goal of mine. So pre-post survey and retention, as well as enrollment.
Mm-hmm. Cool. Yeah. And I guess that gets kind of into the more specific, like, KPIs and success metrics that I'm also super curious. I'm sure everyone here is curious as well, and just understanding, how do you then measure? So you have these goals, you've been very thoughtful about the program design, and then how are we actually measuring the success of that program? So Janelle, you talked about some different KPIs. So what are some other key metrics that have been able to really show that employee impact? Lola, are there any specific, metrics, KPIs that you're tracking for your program?
Of course, we want to tie this program to retention overall, but that's a little more challenging. I'm still working on that, wanting to pull in from our CMS the join date of a mentor, and to see if there's some correlation between that. But in spite of not having that, we're looking at the satisfaction surveys. Like, the Chronus platform has really good surveys that are issued at several different points throughout a user's connection plan. So they've got that 30-day survey, so we can see within the first month, are people happy? And then we've got that midpoint survey, and then the closure survey. And in our own organizational goals, we always use the satisfaction rate, which has been well over 90%, 92% satisfaction rate that people have with the platform and the program, and their match and the algorithm. It's just amazing. People are happy. There's been some changes with the algorithm and the bulk matching, and that has definitely improved the satisfaction rate. So I'll say our satisfaction surveys are the biggest KPIs that we use.
Yeah, that 92% is fantastic. Can't get a whole lot better than that. So great to see. Yeah, I guess, Jess, what are you looking at in terms of tracking program success? What other, key metrics are you tracking?
I would say overall, our big ones are retention and internal mobility. And yeah, those can take time to see. So I'll say, Janelle, we started our program in 2021. So our overall career development program. So it definitely takes time to kind of build up. But yeah, we see 12% increased retention, which is really good when we look at some of our other sort of retention interventions. And we also have metrics on internal mobility and how people are able to move across the organization and make some of those moves that they want to make. And that's actually even higher than our retention rates. So that's really important to us. Other things we do look at raw numbers, engagement, for people that are in the system. Are they active? Are they connecting with each other? And we look at different demographic data as well and compare it to our overall employee population statistics. Are we doing a good job representing our overall workforce? And, do people have access to the career services that they want? When we were first forming our career development program, in 2020, 2021, this mentoring was the most popular request. Everyone was like, I want a mentor. I want to be able to connect with somebody. So it's important for us that we are tracking to make sure, are we doing that? For the people that want a mentor, are they able to get one, and get what they need for building their career?
Awesome. Yeah, thanks for sharing. And Janelle, I know there's also some certain, metrics that you're tracking towards for your program. Can you share that with us as well?
Yeah, absolutely. So our program is a little bit.
I think you're still muted. There you go. Perfect.
Just a bit of a pause. Our program is a little bit newer. So we did a pilot, a small pilot early on with about 50 participants. And then we have expanded it starting in October of last year. So relatively new. So we don't have a lot of metrics to actually share exactly as far as post completion of the program, as well as retention over the course of time, because that is a big one of ours. We want to see that we're retaining people over the course of time, especially over those first 3 years of employment where we know that turnover is high. But so some of the key things that we are looking at thus far is our enrollment, and we're very, very close to hitting the benchmark on our enrollment. Our match rate is pretty solid, and our engagement rate is pretty solid. So happy with those metrics across the board there. We'll continue to kind of track those, and really excited to see the kind of the impacts long term as well.
Yeah. And for your program too, because I know, Janelle, as you mentioned, it is, a little bit newer. How, what have you learned from that experience and launching the program and starting to get traction and kind of going through those steps? Would you be able to share some of those learnings with us?
Yes, Taylor. And I would say Taylor has probably gotten more emails from me than all of her customers combined. Is that accurate, Taylor?
Not quite.
So tip to you all.
I love getting your emails.
A tip I would say as far as launching, like anything, yes, putting Taylor on the spot. I love that. As far as launching, the devil is in the details. We know that. I think it's well worth your investment to comb through what you want your program to be, what you have identified as a need for your potential participants, and what types of services you're hoping to provide them. For us, while Chronus has that foundational kind of outline there, we really wanted to tailor it to meet the needs of our organization and our department. So taking the time up front to comb through it, get the insight from, other staff, other colleagues, other organizations to say, how did you do this? What worked, what didn't work, kind of thing. It's really worth that time up front prior to launching. And then you're not going to have to make as many modifications along the way. Promising there will still be modifications. There will still be glitches. There'll still be things that happen. But if you do that work up front, it does make the process a lot smoother. As far as gaining traction, that is another, I think, a challenge for all of us, in the day and age where we are bombarded with communication from every angle. It's hard to know for sure if your message is getting delivered, received, read, and actually digested. So I think taking the time to do promotional endeavors in multiple venues and to get personal testimonies and do kind of updates and pushes along the way, because just because you assume they may have heard your first big push, they may not. So being persistent in doing multiple pushes. We know, for people to really absorb things, they have to see it multiple times. So not feeling bad about sending multiple pushes and getting creative with how your promotion is getting out there, I would say, is the big one. And getting support from your leaders to really push it on your behalf, because that speaks volumes. If you have your leaders saying, this is important, I'm doing it, you should do it.
Yeah, absolutely. Yeah, having that leadership buy-in is huge. And then in terms of just like scaling programs, so I know for Jess and Lola, you've both been running your programs for a little bit longer. What strategies have been most effective just in like scaling your mentoring initiatives and doing that while also maintaining quality for your programming and maintaining engagement? Jess, can you share anything about that experience for yourself?
Yeah, it's a great question, and we're probably still kind of figuring it out. But a big one is, just to allude to what Janelle was saying, is that you need to have a kind of a constant presence. There is not a week that goes by that I don't talk to somebody and they're like, I didn't even know we had this. So even though we've been around for however long, or people would say, I thought that was only for this group, and it's nope, it's for everybody. Anybody could do it. So we have quarterly events. We have career events because our mentoring program is part of our bigger career development program. We do email campaigns. We just had one for National Mentoring Month that was really, really successful. We saw a big, big jump in interest after our National Mentoring Month. So, thinking about having a month or a week or something, we also do a career week in June, kind of halfway through the year. So we try to be strategic about these big boosts that we do and really trying to put things front and center. Thinking about whatever you can do to remove barriers that people might have about wanting to do this. So I have never met anyone who didn't think mentoring was a good idea, right? Like you meet people and they're like, oh yeah, mentoring, I'd love a mentor, or I had a fantastic mentor. Everyone thinks it's a great idea. And it's just figuring out how to translate that enthusiasm into action. So whatever barriers you can remove. So for us, people tend to think mentors can only be leaders, right? So being able to define a mentor properly, getting people to nominate other people for that. Chronus also has some cool resources for how do I reach out to somebody? What do I talk about in my first meeting? Just as a mentor, what am I supposed to do? And we have our orientation and things like that as well. But just removing any barriers that people would go, oh, I don't know if I could do it, because then it's like just making sure you've got something out there that answers that. Other things I would say are building partnerships with key groups that have your target audience. So for example, we have very intentionally built partnerships with our employee resource groups, and they are fantastic at being able to promote our programs and participate in those. And also, for nursing, our magnet professional development councils, having a presence there. We have a network of career champions across, each of our different hospitals, where we can have people that are targeting things at their specific regional hospital. So a lot of different things. And then after a while, word of mouth starts to happen. Again, every week I get something saying, hey, so-and-so told me about this program. I want to get involved. But that momentum, sort of that snowball, takes a little time to get rolling. But whatever you could do just to have a consistent presence, with key groups that you're interested in is important for growing the program, I think.
Yeah, and I think something you mentioned of like word of mouth and like testimonials, right? I feel like that can be such a powerful way when you're hearing from your peers. Like it's one thing to to get the email, but it's another thing to hear it from your colleague or your manager. Word of mouth I think is so powerful. Lola, I'm curious to hear from you as well, and what strategies have been effective in terms of program growth and scaling for you.
Yeah, I would say initially we had a heavy focus on like enrollment numbers, but again, then you see year after year, if those numbers decline, okay, again, we need to go back to the retention, the engagement of participants. So I would say first, like having a strong onboarding system and setting a good impression at the onset of when anyone participates, especially for our mentors, because we struggle with mentees being consistently like engaged and having the time to participate. And so if we have a mentor that's paired with a mentee that's not as involved, that leaves a really bad taste in their mouth. And then they may not want to participate the following year. So, we've had things like created discovery meetings where we make that one of the first tasks in a connection plan, where members must meet, really get to know each other well, figure out the cadence in which you're going to meet, how you're going to meet, and like just set a good tone so that at the end of the the plan, you're left with a good impression of the program overall. So that good onboarding experience. I would say, the platform has added like certificates, the ability to issue certificates. So our ends really love to show what progress they've made, constantly wanting to educate themselves. So having that tied into like their LinkedIn profile, the ability to say, I was a mentee or just a participant of ANA's mentoring program, that gives them a good feeling. And then again, adding the Flash mentoring program, which is adding flexibility. Again, they're so limited with their time, the time they have to participate. So by adding another track, we're removing that barrier of like time is an issue and giving people options. And yeah, I would say that has helped with like growth, like removing any, like Jess said, removing any prospective barriers people may have so that there's no excuse. And then again, just regularly communicating with them that, hey, this program is here. Oh, and I'm sorry, this is super important. Also changing like with the industry. So anytime there's anything going on, especially like what happened with COVID, making sure we know how to pivot very quickly and rallying up any mentors that we need to help provide support to those who are in need of it. So yeah.
Yeah, no, thank you for sharing all of that. And I think that's so true. Like being able to adapt, you can't necessarily expect to run, the same exact program for, year over year over year. You need to be able to kind of pivot, with changes in the industry and all of that. So I think that's a really great point. In terms of just like leveraging software, and I know Lola, you brought this up a little bit, talking about the certificates and things, but I'm just curious to hear too, what parts of the Chronus platform specifically have been the most helpful for you all. Janelle, is there something specific that you've really kind of leaned on within the platform?
I think number one, and probably the reason that most people go to a platform, is matching. The ability to expand kind of the net that you're casting, but also taking the onus away from us as administrators and saying, I love putting it on the mentee to say, you explore, you pick, you see who's a good fit for you. Because while I think Taylor might be perfect for me or perfect for Lola, I don't want to be the one responsible. I never wanted to be a matchmaker. So that's why I'm not in that business. And that's exactly why I wanted to utilize a platform, because I want the mentee to be able to select their person and make a change if it ends up not working out. Oh, the second thing that I love about the platform, there were two things I wanted to share. Second thing, the ability to put a connection plan. So a guide to the relationship, because we know so many people need to have, it's great you got a mentor, but now what do I do? So to have that kind of structured guidance, especially for those in healthcare, a lot of type A nurses out there who need the checklist. So it works real well for that group.
Yeah, I will say from an administrator end, so I used to work for another organization where I was the administrator for our system-wide mentoring program, and that grew from the time I was there from like 700 employees to 1,200 employees, and it was manual. And I mean, I was going insane by the end of it because it was like Excel and SharePoint and I don't know what. And I was like, this is not really my bag, y'all. Like, I'm the people person. I want to make the connections, like all this stuff on the spreadsheets and things like that, like, is not my bag. And honestly, it was requiring a full-time person. So whenever you look at something like Chronus, like as an administrator, I just have to say it is so much easier to maintain, to keep track of, to look things up, to generate reports, all of that kind of stuff. So on the back end of things, it is infinitely easier than having, if you're starting small, you could try that manual piece, but you will very quickly outgrow that. And it really is going to help you scale your program if you have something in place that's sort of designed to do this instead of you building it from the ground up. And again, just from the user perspective, removing those barriers to connection. That's kind of one of the best pieces about the software. The suggesting matches, allowing you to schedule everything within the platform. So our people can schedule Teams meetings directly in there. They can message each other. For our magnet designation, for most of our hospitals have a magnet designation. Our nurses love to be able to keep track and have a log of their meetings and goals, etc., that then they then use for when they have to re-up their magnet designation. So that all really helps. Also, there's an app, so people can kind of access it anywhere. We have a lot of people that aren't necessarily at a workstation all day, and it connects very easily to Teams. So again, it removes barriers for you as an administrator, but also for the user, which I think just makes it so much easier to manage and grow.
I'll say, yes, bulk matching hands down is a game changer. I was not part of the generation that did have to manually, match people, thankfully. But I will also add the email campaigns feature and the user reports. I love the email campaigns because you can set them up to automatically distribute messages according to what you're seeing with the connection. So for instance, if I've had users that haven't connected in 30 days, I can set up my email campaigns with user reports. I can create a user report that says, add everyone to this list who hasn't connected in 30 days or who hasn't filled out their survey. And then I can then go into email campaigns and select that user list and say, send a message to them to remind them to complete the survey for our own programmatic development. Or I could say, send them a message to make sure that they connect. Just like certain reminders, and then it takes the manual labor out of managing the program. I will also say with user views, I receive throughout our organization requests for certain reports, like how many members in North Carolina participated last year. I can quickly go in and pull all members based on their specific state and then give it to them. And then our CSNA states can go and take action to help us promote the program. So I love the automated part of user reports.
Yeah, and I'll say one more thing. I know, just again, as somebody who did have to manually administer these things, that's why I'm like, this is great. You can also designate other people to be able to generate certain reports. So like our career champions, there's somebody at each one of our hospitals that's an administrator and mentor match, and they can go and generate reports for their entity, right? So they don't have to come to me and say, hey, could you let me know how many users joined or how many people are connected or, blah, blah, blah. They can kind of go in there and do that themselves. And then one final plug, I just we're calling out Taylor so much. Hopefully we're not embarrassing you, but Taylor, Chronus also has really good support. So if I'm ever having an issue, I can talk to Taylor or other people, or if I'm like, hey, I want to build a special page. Can you help me do that? And yes, they can do that. So it's just, you've got a lot of support around you. So you can kind of focus on the things only you can do in your particular role and kind of why you're there versus, building out a structure and maintaining a structure.
Awesome. Well, thank you all so much for all of this insightful discussion today. I know I've learned a lot from you all, and I'm sure our audience has learned a lot today too. So I think what we're going to move on to next is actually the audience Q&A session. But before we move on to that, I just wanted to give everyone a little bit more information on Chronus so we can jump over there. So at Chronus, we believe organizations only reach their greatest potential when their people do. And we do this by helping organizations create connected workplaces where people are able to thrive. And we put employees in the driver's seat of their development. And we do this by centering around purpose. In our approach, purpose-driven development is fueled by three key aspects that research say makes employees feel more fulfilled. So this is relationships, impact, and growth. And with purpose at the core, we deliver our approach through these different solutions. So we've talked a lot today about mentoring. We also have our connection communities, onboarding, purpose conversations, and sponsorships. So if you'd like to learn a little bit more about what we're doing for organizations like yours, go ahead and check out Chronus.com, or you can click on that button in the right corner. It says talk to our experts, and one of our members of our team would be happy to chat with you a little bit more about Chronus. And with that, we'll move on to some of our audience Q&A. So if we have any questions here in the chat. All right, so something it looks like that came up from Jill, and I think this has to do with like promotion and email activity. But how do you get beyond the email overload? So to make sure that people are like getting your messages and taking action, but maybe not feeling like it's too much.
Do you have one person? I'm sorry, did you call on anybody or just in general?
Oh, I didn't, but if you want to take it, you're certainly welcome to, Jess.
Yes, email can get, everyone can get a little bit just overlook. It's easy to overlook emails these days. So I think being able to build those partnerships with other people that can get your message across is really great. Like ERGs or like different, shared governance councils, leadership meetings, town halls, that kind of thing. Just being able to get in front of people a little bit can really help, and they start to, associate you and your program. Like, oh yeah, hey, I've seen you before. I've been meaning to do that. And we also hold events around topics that are, big hot topics that we hear. So one of the other services we provide on the career development team is one-on-one career discussions with people, resume reviews, mock interviews, and we hear different concerns that they're having coming up. So then we create our quarterly events around those topics. So in order to drive an audience, like, oh, this is something that's really interesting people right now. So just kind of finding different ways to get in front of people and make some of those personal connections, I think is really helpful.
Yeah, sure. It looks like another question that came in. Are there any specific topics or discussion items that you're kind of programming into your mentorship programs, or is it mainly like self-led discussion by your participants?
We have what's called a mentee and mentor advisor, and they issue out in communities that we run off the platform. They'll send maybe prompts, different questions, asking how things are going or what's the biggest challenge you face. They put prompts out there, and that sparks engagement, and they help just kind of keep track of what's going on and what people are going through in their different connections.
Within our program at my organization, well, actually the multiple tracks at our organization, we do provide quite a bit of guidance up front. So our program is structured for 8 months for a mentoring relationship. The first 4 months, we give them strongly encouraged discussion guides or topics to talk about. Those do have some brief pre-work associated with them. It might be like a little 3-minute YouTube clip or something, just to kind of get them thinking about concepts that they may want to talk about with their mentor. And those are given to both the mentor and mentee so that they're both prepared. But again, they're strongly encouraged. They're not required. If someone comes in with a solid plan, they got their goals, they know exactly what they're working on, they don't need that guidance. So they can just choose not to use it. But for those who are coming in with a little less clarity on what they're working on and need some help in figuring that out, those first few meetings can really help break down kind of that discomfort and help them establish a rapport and then move into the relationship. The second half, we don't put any structure on it. We just encourage them to continue to track their goals, their progress, and make notes of that along the way. But there isn't a lot of structure the second half of it, because at that point, we're hoping you've had the relationship established and you're well on your way to making your way through your journey.
I think for us, this is something we could build out more, that we could have more structure to ours. So we have guidance on, how to have a great first meeting. And then just in general, here's how you might want to structure things. Excuse me. But I do think that's something we could build out more, especially based on some things I've heard mentors say, where they're like, I don't know how to structure the meeting. And it's like, well, actually the mentee owns the meeting, but I think that can be a barrier for mentors. So we created a guide recently on, things you can do. So you've got a mentee and they want to learn this aspect of leadership. They want to grow into leadership. They want to learn change management, strategic planning. Here's some different ways you can help them do that, by posing different scenarios, having them shadow you, etc. So again, removing those barriers, removing that, I don't know, because then I think that would help. But I think that's an area that we could do more.
Mm-hmm. Yeah. Yeah, I think.
Go
ahead.
Sorry. I was just going to add, Taylor, having the, I think maybe my lens initially was a little bit different, because when we started using this platform, we piloted it with a cross-cultural mentorship program where it was very intentional about having the conversations that people want to have, but they don't know how to start and don't know how to initiate. So putting that structure in our connection plan kind of took away that nervousness. They're like, oh, well, I've got this assignment. I need to talk to you about pronouns and, names and preferences and what you like to be called, why you like to be called that. So putting some of those things out there right up front to talk about, that some people might feel very comfortable talking about, other people don't. But we know the importance of individuals being able to be their authentic self, especially in a mentoring relationship, to be able to be you and be supported by someone who understands you is really, really crucial early on. So putting some of those things out there where we just make it easier for them to have some of those conversations that can be a little bit uncomfortable.
Yeah, absolutely. And I like how you mentioned too, Janelle, of like just having the support and structure there. And like, if somebody doesn't necessarily need it, that's totally fine. But at least they have that feeling of support. If mentorship is something that's new to them or they're not quite sure how to approach it. So I think that's great. Looks like, and if there's any other questions, feel free to pop them in. I know we're getting close to the end of time here, but we may have room for just one more. Are there any particular like promotional tactics that you're using in terms of promoting your programs to like the right audience, like kind of narrowing in on like a specific audience for your programs? Anything that you're doing there?
For us, if our key stakeholders have regular meetings, then we make sure we get an invite to those, or we show up quarterly to give an update on things, even if it's just, hey, here's what we have coming up. But we just kind of make sure that we're on the roster and check in with them, because they kind of help magnify the program across the system. They could be a mouthpiece to their members. And honestly, I could come into a group and talk about it. But if you're hearing it from someone who's a part of your same group, then that person is going to be more influential. So getting on different calendars is helpful.
I'll say we have what's called membership onboarding webinars. And so we have a standing slide that talks about the 2 program tracks we offer. So that allows for new members, when they're being oriented into all ANA member benefits, to be made aware more specifically about the mentorship programs.
All right. So I know we're getting right up to the end of time. We have about a minute left. So we'll go ahead and wrap things up. But thank you, everyone, for spending this time with us today. And of course, thank you so much to Lola, Janelle, and Jess for sharing all of your knowledge with us today. And we will be in touch just within the next 24 hours with a recording of this event. And if you would like to connect with any of our panelists today, you can over LinkedIn. So we have their information here if you would like to reach out. And of course, as we mentioned before, certainly reach out to Chronus if you want to learn a little bit more about how we're helping build mentoring programs for some of the world's biggest companies. So thanks everyone again, and have a wonderful rest of your day.